May is Mental Health Awareness Month, and today we're highlighting the resources and support that's available to somebody who is in crisis. Here with us to discuss is Mike Andrick, Sweetser's Senior Director of Adult Crisis and Residential Services. Mike, thank you so much for being here. So, when we say somebody is in crisis, what does that actually mean?
Sure. Thank you, Megan. What that could look like is someone could be experiencing an increase in depressive symptoms, anxiety-related symptoms where there's physiological symptoms of anxiety. Someone could be experiencing withdrawal from substances. Someone could be having pronounced delusions as part of their presentation. Someone could be have made threats to harm themselves or harm other people.
And when somebody calls the crisis hotline, what happens next? Walk us through sort of the process.
Sure. So people can call the statewide crisis number, the 988 number, and what happens is that's like a dispatch system to different geographic regions in the state of Maine. And so it goes to a triage department, then it gets dispatched to a mobile worker, and a mobile worker will go to that location. So that could be someone's home, that could be an emergency room, that could be a school, that could be a homeless encampment, and we're trying to meet people where they're at. So it's really a no wrong door process that we embrace as part of our work doing the mobile crisis work.
What do you mean by no wrong door?
Easy to access our services, right? So someone's experiencing a psychiatric crisis, that's a crisis for that person. So we want to make sure that we're making every attempt to meet someone where they're at.
Interesting. So, this may not be the only time that they experience a crisis. And if they call, do you set them up with long-term help, or how do you go from that initial call? How do you move forward?
Sure. Great question, Megan. So we're embracing trauma-informed principles as part of that work, right? That's really important, meeting folks where they're at. And, we're doing that assessment, that comprehensive crisis assessment with them and attempting to determine the appropriate level of care as part of that presentation. So it could mean new referrals to systems, like frequently individuals that are experiencing a crisis, their formal supports are fragmented. So frequently we're doing referrals to our crisis residential units that Sweetser operates in different regions of the state of Maine. It could be new referrals to different providers to access medication management or ongoing therapy or case management services.
Yeah, so just next, jumping off that, when you know someone is in crisis or you have a friend who you think needs some help, what do you do? What should you do?
We would encourage folks to call that statewide crisis number if we know that someone is in a psychiatric crisis, and calling that number is going to connect folks to the resources that are going to help them stabilize.
All right, Mike Andrick, thank you so much for joining us. Sweetser's Senior Director of Adult Crisis and Residential Services. What you do is so important. We appreciate you coming on the show.
Thank you, Megan.